name's Zoe. We're going to be doing our IV pass-off. I'm just going to come in and introduce myself. Hi, my name is Zoe. I'm going to be your nurse today. We're just going to be placing an IV catheter for you. Can I have you tell me your name and date of birth? Okay, we've got the right patient. I'm just going to close this door for your privacy. And then I'm going to lift him up to a low Fowler's position. This is what you would do. We're going to be using this arm, but this is where we want him. So we're going to be placing an IV in your arm. The doctors ordered that, and it's going to be left in your arm. That way we can administer medications, take out blood for labs, anything like that. Do you know, have you ever had an IV before? Yeah? Okay. Do you know, are you allergic to anything? Like, were you allergic to the Turaden, the tape, anything like that? No? Okay, good. So we're just gonna, I'm just gonna get all this stuff ready right here. Let's see. That way we've got it. Okay, so do you have any fears or anything like that with your IVs? Are you scared of getting an IV? No? Okay. Alright. So, just getting this. And we don't want to touch the end of this because it is sterile. I'm just gonna flush some fluid in there real quick so it's ready to go when we're ready to use it. And then I'm just going to get the air bubbles out of that. Perfect. And then we are gonna assess the veins on this patient's arm just to see which veins they have that are good. Looks like he's got some good veins right there. And then we're just gonna go over here and do it on this one now. Okay, let me do some hand IV and throw it on the ground first. Let's see. Okay. Put some gloves on. Hands off. Okay, we're gonna place this tourniquet right here, about 3 to 4 inches above the vein that we're gonna use. And then we're just gonna clean it off right here. And it says to clean it for about 30 seconds and then let it dry. We're just gonna go with that and say that it's 30 seconds. Okay. I'm just getting this needle out. I'm sure you know that, but just to educate you on like misconceptions that people have, this IV that's going to go into your arm, it is the needle. The needle's going to poke and get into your vein, but we're only going to leave this little catheter, this little plastic catheter in there. We're not going to be leaving the needle in there. Okay, so we're just going to hold the skin taut, and then we're just going to go right here. Maybe poke till we get the flashback. Maybe. There we go. we've got flashback, and I'm just gonna go a little bit further and then advance this catheter in his arm. And before we do that, we'll pull this tourniquet off and then apply pressure right here so that the blood isn't trying to go everywhere. Just that way. Get our syringe back, maybe there. Okay. Okay. So now I'm just gonna pull back on this to make sure that we do have blood. Maybe we don't. Oh no, we do. Okay. Then we're just gonna flush 5 mLs in there for him. Maybe we're not. I don't think I'm in the right spot. I got my flashback though, so I don't know. Let me pull back and see. It's pulling fluid back, so I don't know why it's. I might have kinked the catheter. Oh no, there we go. Okay, so we're just gonna flush 5 mLs in there. I'm just gonna pull this off. Okay. We're gonna just gonna tape this down so it holds for a second while we get our tegaderm over here. This one down right here. And then we do have the date and time and everything, and I would just place that on here so we know when this was inserted and what gauge of needle it is and all of that. And then the trash can is. Just gonna hold all this stuff before I throw it away so I can. Okay, and then we put the patient back in a comfortable position, make sure that they are okay, and then we're gonna go document where we put the needle, what arm we put it in, which vein, the date and time, and then if it had any, how the patient handled it and everything like that.